Hi, everyone. I'm Jim Benham. November is Prematurity Awareness Month, a time to raise awareness of preterm births and the concerns surrounding preterm babies. Joining me now to talk about all this, neonatologist Dr. Anna Zimmerman. Dr. Zimmerman, thanks so much for being with us. We know there are a lot of issues when it comes to all pregnancies. Do doctors seem to be seeing more preterm births these days?
So interestingly, I think there's this conception that in the United States, you get pregnant and you're going to have a healthy baby. And most of the time it does go that way, over about 90% of the time. But there is a portion of women who are going to deliver their babies prematurely. That has stayed consistent over the years. But I think it always comes as a surprise for anybody who does deliver a premature baby.
Doctor, tell me, how soon before the due date does it have to be considered a preterm baby?
Sure. So any baby that's born before 37 weeks is considered premature. But there are varying degrees of prematurity. So 34, 35, 36 weeks, this is late premature babies. Kind of 28 to 34 weeks, those are just our premature babies. And then anywhere from 22 weeks up until about 26 weeks, those are extremely preterm deliveries and are micro preemies.
Okay, gotcha. So what types of warning signs might there be for pregnant women to be on the lookout for when they start getting into, say, 22, 24 weeks? What should they be aware of?
It's interesting because everybody is going to present a little bit differently. Certainly, if you have water, your water breaks, so you have some leakage. If you start having some funny back pain or funny abdominal pain, you just feel really, really exhausted. It doesn't always feel classic. I myself went into preterm labor at 32 weeks, and I just thought I had overdone it the day before. I had no idea that I was in labor. So it's really common to say, you know, hey, my belly just hurts a little bit, or I'm having a little bit of back pain. So everybody's going to be slightly different. If you're feeling off, it's always good to check with your OB.
Good call. For a preterm baby, what's the range of special care, special treatment that they might need?
So any baby that's born prematurely should be cared for in a newborn intensive care unit. And that's because we have the nursing specialties, the nursing specialists that we need, as well as all of the equipment that's needed for preterm babies. Oftentimes they need help with their breathing, whether that's a ventilator, having a breathing tube, or even CPAP or just a little bit of oxygen. They need specialized nutrition through an IV until we can work them up onto full feeds. We need support from a nutritionist. They need special eye exams to ensure that their eyes are maturing appropriately, because your eyes don't mature until you're actually past your due date. And then they also sometimes need surgery if we run into complications. So you want to make sure that the hospital you deliver at has the capability or has a sister facility that they work closely with that can provide those services.
Boy, so many considerations and all that. As we mentioned, Prematurity Awareness Month. What do you hope that the general public gleans out of the information that will be coming out this month?
So I really hope that people understand two things. Number one, prematurity happens, and it is not your fault. It is not the mom's fault. I can't emphasize that enough. There's enough things in this world that create maternal guilt that if you go into preterm labor, this is just something that happened. It's okay. We are going to take care of your baby. I think the second thing that's really important is that I think a lot of people view prematurity as this, for lack of a better phrase, kind of a death sentence, right? Like it's the end of the world and there is no hope. But for the most part, even though the NICU is intensive care, and even though those 3 to 4 months can be really, really difficult, the majority of our babies do really, really well. And outcomes are so much better now than they were 10 years ago, or 20 years ago, or 30 years ago. That's really difficult to give parents this as much hope as they really deserve to have, right? Like, you deserve to have hope. These outcomes are really good. So let's hold on to that. That's what I want people to know.
Yeah, and and finally, Anna, I'm thinking that between the doctors, nurses, the rest of the staff, you probably have seen just heroic work by healthcare professionals over the years when these beautiful bundles of joy arrive very early.
Yeah, I am super grateful for everyone in my team. Everybody that works in the NICU, from the nurses to the respiratory therapists, the surgeons, the other physicians, the administration at the hospital, everybody really fights for preterm babies because they are so worth having and fighting for.
All right. Well, Dr. Anna Zimmerman, Doctor, your hard work is so much appreciated, and also your ability to help us spread awareness during this very important month. So take care, and thanks for joining us.
Thank you so much for having me.